Hi, I am Dr. Kumar, Anesthesia consultant practicing in Jayanagar Cloudnine and Kanakpura Cloudnine. So, in obstetric emergency, we have under two situations. One during pregnancy, the second during labor. So, let's consider during pregnancy. The first situation is a miscarriage. For some unavoidable condition, miscarriage takes place, and sometimes the product of conception is not expelled completely, for which the patient has to be taken for a short surgical procedure called as DNE. Here the anesthesia where we give is either a short general anesthesia or we give one more procedure called as the saddle block. Saddle block is very similar to a spinal anesthesia. The next situation which arises is a bleeding condition called as abruptio placenta or placenta previa. In this, the anesthesia depends upon the mother's health condition stable. In case there is any excessive blood loss and the mother condition is unstable, also the blood clotting factors is abnormal, then we will be giving a general anesthesia. If the blood loss is within the acceptable limits and also the mother's condition is stable along with the blood clotting factors within normal level, and the choice would be a spinal anesthesia. The next situation which arises is called as a PROM, that is the pre-labor rupture of membrane. Here it occurs before 37 weeks and the choice of anesthesia would be a spinal anesthesia, and this would be the safest for both the mother as well as the baby. The obstetric emergency, when it occurs during the labor, we have a situation called as the prolapsed umbilical cord. This is a very emergency situation as the blood flow to the baby is compromised and the baby has to be delivered as early as possible. The choice of anesthesia would be a general anesthesia. If the baby condition is stable, then we can give what is called as the rapid sequence spinal. The next situation which arises is called as the postpartum hemorrhage. Here there is an excessive blood loss which happens following the delivery. The delivery can be normal delivery or a cesarean section. And suppose the conservative management, that initial steps management fails to control the bleeding, the patient has to be taken up for a surgical procedure, then again the anesthesia choice depends upon the mother's condition. Suppose the mother's is unstable, blood loss is excessive, then the choice would be a general anesthesia. If at all the mother's condition is stable and the blood loss is within normal limit, also the blood clotting factors is normal, then the choice would be a spinal anesthesia.